Thank you. Hello, everyone. Thank you for the invitation, and thank you so much for your hospitality. No one trained me on this, by the way. Okay. So today we'll talk about the Lebanese experiment in advocating for better drug laws. And our campaign is called towards better drug laws, health, justice, and safety. First, let me introduce you to the Lebanese law on drugs that was written in 1998. It criminalizes drug use and addiction. However, it adopted a distinctive approach to the issue that when a person is arrested for drug use, he should be given the choice between treatment and incarceration. Of course, when the person chooses incarceration, it's the end of the story. He's going to jail. However, if he chooses treatment, then he should be referred to the addiction committee that is stipulated in the law, and that is responsible for making the initial assessment of the relation with the drug or the substance used, and then he should be referred to the governmental treatment center. This is the law. This is the text, and it is very, very, very far from the reality. When someone is arrested, I guess you all know that he is referred to a judge, and the judge again asks him if you want to choose treatment or incarceration. It is normal that everyone chooses treatment, and when the judge goes back to the law and says that the law is to refer him to the addiction committee, unfortunately the addiction committee doesn't exist. It is inactive. So the story stops here. The judge has nothing to do but to go back to the incarceration option, and people, even though they choose treatment, but the state is incapable of treating them because it did not activate the addiction committee, and of course there's no governmental treatment centers. So people from 1998, starting 1998, were incarcerated and sent to prison. That's why SCOON has planned on addressing the issue. So we made a situational needs assessment to know what is the reality of drug addiction and drug use, and how's the national response to it. So we launched the situational needs assessment in 2009 to evaluate the situation of drug use and the needs of treatment centers. And treatment centers are from the NGOs. There were no treatment centers for the state. Plus, to examine the knowledge of judges with regards to available treatment services, because as you can see, the only category that we were able to coordinate with were the judges, because they were the persons who are referring people to incarceration. And of course, the situational needs assessment allowed us to examine medical practices and measures that were present at that time. I will share with you some of the numbers that were the result of the situational needs assessment. The age group of drug use, the biggest range was from 18 years old to 34 years old. The biggest number of age groups who people were actually seeking treatment are 18 to 24 years old. So most youth who were having problems with substance use were seeking treatment at the age of 18 to 24. However, only 42% of people seeking treatment actually got treatment. And the most used substance was cannabis. And the situational needs assessment allowed us to discover that all the treatment services, prevention services, and all the services related to drug use and abuse are centralized. Going back to judges, we had to examine with judges what are the referral systems available and how other countries respond to this issue. So we Schoon planned an educational tour to France for judges and members of CSOs. Back then, France has legalized the OST, the opiate substitute therapy, and we went there to explore and how to work to improve the coordination between Ministry of Justice and Addiction Treatment Center. So that was the idea. Now that we have made our situational needs assessment, and now that we have sat with judges and we have deep discussions about the law, we were sure that in order for us to improve the quality of life and quality of services offered to people who use drugs and their families and the community, we had to revisit the drug law. And because the drug law has been inactive due to the inactivation of the committee for like 10 years, we organized specialized roundtables with judges, law practitioners, doctors, psychologists, and all people that were interested in the subject. And the specialized roundtables resulted in amendments to the drug law. The amendments were divided into four sections. What is one that is related to penalties and sanctions, and I'm showing you a few of the amendments because it's a law and it's very not comfortable to say the whole law and the all amendments. However, the most important things that we address that use criteria to differentiate criminal acts, that there is criteria to what is drug use and what is drug abuse, what is trafficking, what is possession, because our drug law is not clear in that area. And reconsidering the penalty of drug use without physical dependence. And we administered a new concept to Lebanon that is alternative sanctions, like community service, for example. As for the treatment measures that were addressed in the amendments, we amended the referral to appropriate treatment because the law only says that a person should be referred to treatment center and inpatient. Back then, Schoon was the first outpatient center, and in 2011, OST was legalized in Lebanon, so that should have been taken into consideration. And using more understanding text of drug use and drug addiction, and encouraging voluntary recourse to treatment if a member of the family takes this choice. As for the stigma and confidentiality, usually when a convicted person, the sentence is written on his criminal record, so this limits his chances of getting employed or having education, and to prevent or stop the publication of names of convicted drug users offenses in public records and in public newspapers. As for the applied procedures and mechanisms, normal, our first amendment was to activate the addiction committee and decentralize it because it was only operating in Beirut and Mount Lebanon, and reconsider the composition of the committee. Because the nature of the committee is supervising treatment, we think that there's no use of putting a member of the internal security forces as a member of the committee. So our amendment was to remove the member of ISF from the committee and keep it just for therapy. Now that the law amendment was ready, and it was, as I said, a result of the roundtables, and it was a joint work with all treatment centers in Lebanon. Our strategy was to create strategic allies with the parliament, with the police, and with the media. These are the three main important factors in Lebanon. So with the parliament, it was very successful because we lobbied with the parliament when it was active back then, and 6 deputies signed the draft law to be submitted to the parliament. And these 6 deputies coordinated with their blocks to adopt the draft law. So the lobbying was very successful because we have now 6 blocks out of 8 blocks, and this is the majority of the parliament adopting the draft. And I say adopting, but it is not inside the parliament yet. I'll let you know why. With the police, we have a strong relationship with the police, with law enforcement bodies, starting with the internal security forces and to everyone in that area. Because we conduct specialized and continuous drug training, and because we often approach the police in a positive way to ask them for participation in human rights-based campaigns, and especially in our Know Your Rights campaign. It's a different issue, but police is our partner in Know Your Rights campaign that aims at empowering youth, drug users, and their families about their legal rights during detention. And media, we have strong allies with media in order to create a public opinion. We send press releases, we make social media campaigns, and we have featured interviews. However, with all this great work that not only SCOON is doing, but SCOON with all treatment centers in Lebanon, still drug policy reform is not a priority. The state has never thought of it, because we are now living in what the Lebanese call a presidential vacuum. We have more than 100 days without a president because the parliament has failed to elect a president, and because of the opposition and the very complicated political situation in Lebanon, our government is freezing, so it's not working, and thus the legislative work is freezing, no legislative work. And because we're suffering from 2 years and more of on and off union strikes, and because we have no elections, and because Lebanon, I'm sure you all know that it is in the middle of the conflict around us and the armed conflicts, and because our priority now, the state's priority, not mine, is to get back our soldiers and to come up with a solution to the refugees and all this, drug policy is not a priority. I'm telling you this just for you to know what did we do, how did we adapt to these challenges, and because I'm sure that many of these things are common among everyone. So, since we were not able to reconsider the drug law as a whole, the whole law, we managed to revisit the minor policies in the law. As I said before, we advocated for the legalizing of OST, and after several discussions and roundtables and creating a public opinion about the issue, as OST is legal now, and more than 800 people are benefiting from it since 2012. And in other terms, what does this mean? That it's ensuring a main right for people who use drugs, the right to health and treatment. We created a broader access to treatment. We reinforced a relation of trust between people who use drugs and governmental institutions. And we build up the community's readiness for harm reduction programs. If you remember, I said that Lebanese drug law was written in 1998, and the committee, which is the core of the Lebanese drug law, which is the essence of the law, was only activated in 2013. So it is not an easy job in Lebanon, because from 1998 till 2013, more than 15 years, people were incarcerated instead of given treatment. In early 2013, the Drug Addiction Committee started referring patients to treatment centers. A treatment center from the NGOs. We still don't have the state's treatment center. The activation means that it is the first step in treating drug dependence through healthcare and not punishment. More referral to treatment, more chances of treatment. And it really resembled the importance of effective coordination between all treatment centers, NGOs, and CSOs. And now that the Addiction Committee is active, then a convicted person will not have a stamp on his criminal record that you were once a drug user or you were convicted or sentenced with drug use offense. So we are renewing the chances to social and economic life, saving rights of citizens and of youth in Lebanon. And the committee was activated due to pressure that we did in courts. We used an advocacy tool that is very important and that has gained Lebanon and the judiciary system in Lebanon great milestones, that is called strategic litigation. Basically, it's a pleading for drug user cases in courts that we kept on pushing and repeating that we need it is the right of drug users to go to treatment and not to courts and not to prisons. So the strategic litigation has finally gave positive feedback, and the committee was activated. Thank you. I hope I didn't take much time, and thank you so much for your time.